Hi, my name is Khalid Hashi, and I'm the founder of OGOW Health. We're a digital health organization working to improve maternal and child health outcomes in Somalia. So with the FIT funding, we tested our innovative solution supporting two maternal and child health facilities. And what we really wanted to understand is if our social behavior change programs, both in SMS and in IVR audio, could help improve dropout rates and coverage rates in immunization within the facilities that we were supporting. My work was inspired by my first-hand encounter navigating the health systems in Somalia, where I met my only living grandparents. Everything was analog at that facility, and I was really there to help transcribe her records and also help my family find my grandmother a suitable hospital for her services. That really inspired me to initially come up with just a prototype and a pilot for that particular facility. And it was through that experience that I've learned a lot of the challenges within the maternal and child health space in Somalia, and then really expanded our offerings to help tackle that challenge. One of the preliminary findings at the start of the project was how do we create more inclusive programming, ensuring that mothers and caregivers at large have the information in easily digestible ways. And one thing we did was record these messages, contextualize them, make sure that they stick, so of course that they're culturally appropriate. And these messages are now offered in many dialects, several regions and states across the country. We've seen over 90% of adherence to immunization rates within the targeted facilities. And we were also able to hire competent gender specialists and advisors on this specific area that were helping us include the gender markers throughout our programs. One really interesting insight during our design of our workshops was ensuring that, of course, we needed to get feedback directly from beneficiaries, primarily mothers who are at the core of our programming. Finding time where we can really benefit from their lived experience, their learnings could be challenging. So we're very grateful that FIT offered us the flexibility and the resources to make sure that, participants were considered in that design. So we were able to ensure we had transportation on site. We had different hours of workshop days that we offered communities to attend. But most importantly, it was that we had budgets assigned and delegated for this specific task. And that was something we just simply did not have prior to this test interventions. We were encouraged to learn. And, of course, we went through a lot of different funding streams in the past where your main focus is on just results. Where with FIT, we didn't have that added pressure, and we were really encouraged to iterate as many times as it took to get it right. One really main exciting milestone was we collaborated and partnered with UNICEF and ministry partners to also expand our toolkits to offer and strengthen nutrition programs in Somalia, which are now supporting over 600 facilities across the country and a footprint in every state. We also recently moved into the transition to scale funding stream through Grand Challenges Canada, which will now allow us to really accelerate our work and the foundations that we were able to set with the preliminary global affairs phase of the seed fund. A lot of exciting things, lots of new learnings, and we're excited for all that's to come.